In this presentation, you will be learning all about strokes. By the end, you should be able to describe what a stroke is and the different types of strokes, identify the typical signs and symptoms of a stroke, discuss response and treatment plans in relation to a stroke, and apply preventative measures to reduce the likelihood of having a stroke. How many of you in this room would say that you live a sedentary lifestyle? How many of you drank in excess this weekend? How many of you feel like you regularly do not get an adequate amount of sleep? Think about it. If you answered yes to the majority of these questions, you are at risk for a stroke. A stroke is a public health problem worldwide, representing the second most common cause of death and major cause of disability in adults. Approximately every 2 seconds, someone across the world has a stroke. Strokes occur when blood supply to your brain is blocked or reduced. So what does that mean? In order to function, your brain needs oxygen. Blood is the major transporter of this oxygen to the brain. When you experience a stroke, within minutes, your brain cells start to die because it's not receiving the blood or nutrients it needs to function. There are 2 different types of major strokes, ischemic and hemorrhagic. An ischemic stroke occurs when there's blockage in an artery supplying the brain. Imagine the traffic that results from a car wreck on a major highway. The flow of traffic comes to a halt. Just as the traffic is forced to stop flowing, during an ischemic stroke, the blood to the brain stops flowing. The wreck on the highway can be the equivalent to a blood clot in the brain. A hemorrhagic stroke occurs when a blood vessel bursts or leaks in the brain. Imagine a balloon bursting like in this picture. This is similar to when a hemorrhagic stroke occurs because the blood vessels burst. There are 5 ways to recognize a stroke. The first is trouble with speaking or understanding. This includes experiencing confusion, slurred words, or difficulty understanding speech. The second is paralysis or numbness to the face, arms, or legs. If you're having sudden numbness on one side of the body, try raising both arms overhead at the same time. One arm should fall. Also try smiling, and if one side of your face seems droopy, a stroke could be occurring as well. The third is trouble seeing in one or both eyes, such as sudden blurred, blackened, or double vision. The fourth are headaches accompanied with vomiting, dizziness, or altered consciousness. And the last is trouble walking, evident by stumbling, loss of balance, or coordination. So what do? A quick way to remember stroke symptoms and the actions to take is to think FAST. FAST stands for facial drooping, arm weakness, slurred speech, and then time to call 911. Typically after a stroke, there are many options for you to recover from that stroke. You can seek treatment from physical, occupational, and speech therapists. These therapists will work together to help you live the most independent life possible. As you watch this video, think about which person is more susceptible to having a stroke. So how can you prevent a stroke? Control high blood pressure, lower cholesterol, quit smoking, seek help if you have diabetes, maintain a healthy lifestyle, treat sleep apnea, and do not do drugs. While you've been watching this video, 150 people have experienced a stroke.